wanted to have total control over the opening of their states, but now they want to have us, the federal government, do the testing.
Tension building over those stay-at-home orders, protests in several major cities.
No more tyranny!
In Florida, residents flocking to reopen beaches, and in hard-hit New York State, new hope that the curve could be on its way down.
We controlled the beast. We apexed, we plateaued, it's coming down the other side. But the beast is still alive.
Also this morning, new concerns about those antibody tests, which many believe hold the key to opening up the country. Dr. Anthony Fauci joins us live with the latest.
ABC News exclusive. Facebook takes on COVID-19. The social network giant makes a big announcement how they're tracking the disease and pinpointing hotspots.
There are some things that I think would jump out to you.
Facebook CEO Mark Zuckerberg sharing the first results this morning.
On the brink, the major American department store chain on the verge of bankruptcy. The new report this morning.
A Broadway star's battle with COVID-19. Nick Cordero losing his leg following complications from the virus. His wife Amanda speaking out for the first time on his condition after those serious measures.
Violent storms tear through the Deep South for a second straight weekend. At least 7 tornadoes reported, damaging homes. This morning, tornado watches from Florida to South Carolina. We're tracking the latest.
And Michael Jordan like you've never seen him before. The tip-off to The Last Dance trending big overnight. The ESPN docuseries scoring big with players and fans about the GOAT's final championship season with the Chicago Bulls, featuring footage kept under wraps for more than 2 decades. And this morning, the exclusive clip from episode 3, only on GMA.
Live in Times Square, this is Good Morning America.
Good morning, America. Happy Monday, everybody. We hope everyone had a safe and wonderful weekend. Happy to have Amy here in Times Square with me on this Monday morning. And Robin, you got a little Monday motivation for us.
Yeah, those sick moves by MJ, that's Monday motivation. Yeah, but also this. Take a look at this group of more than 40 workers in Delaware County, Pennsylvania. Clocking out for the first time, are you ready for this? First time in 28 days. They lived, worked, ate, slept at the facility, Brascom, America, making equipment for healthcare heroes on the front lines. And George, another reminder of how so many are doing their part during this pandemic, George.
Yeah, their commitment is so inspiring, Robin. This marks the third month since this virus first began here in the United States. And as we're looking now to top more than 759,000 cases, almost 40,000 deaths right now. Now, the president and House Speaker Nancy Pelosi have now saying that they are close to an agreement, close to a deal to help more small businesses across the country with new aid package of up to $450 billion to boost that small business loan program that has run out of money.
And then New York Governor Andrew Cuomo saying coronavirus cases in the nation's hardest hit state are now on the decline, saying, quote, "We controlled the beast." Dr. Anthony Fauci is standing by to talk with us in just a few moments.
But first, we begin our coverage with Whit Johnson outside Mount Sinai Morningside Hospital in New York City with the latest. Good morning, Whit.
Michael, good morning. New York might be past the apex, but the painful reality is hundreds are still dying here by the day. Most agree the key to reopening the country is more testing, but there is a growing disconnect between the states and the White House over who should lead that effort.
This morning, as the U.S. death toll tops 40,000, the debate heating up on how to reopen the country. President Trump announcing plans to invoke the Defense Production Act to make more swabs needed to boost testing.
We're preparing to use the Defense Production Act to increase swab production in one U.S. facility by over 20 million additional swabs per month.
Despite calls from governors for more federal coordination, the president insisting testing is a local issue.
The governors wanted to have total control over the opening of their states, but now they want to have us, the federal government, do the testing. And again, testing is local.
In hardest hit New York State, the number of infections reaching nearly 250,000 people. But look at the daily hospitalizations over the last month, the curve seemingly on its way down. But officials warning it could rise again.
We apexed, we plateaued, it's coming down the other side. But the beast is still alive.
The state health department rolling out an antibody testing survey starting today, beginning with 3,000 of the state's nearly 20 million people. But now the New York Times reporting problems and inaccurate results with some of the antibody tests available, and that many are made by companies in China with little oversight. This as parts of Florida are already taking steps to reopen. Beachgoers swarming the shores of Jacksonville open to the public again on Friday with restrictions and limited hours.
No more tyranny!
But frustration is boiling over. Protests erupting coast to coast with calls to end stay-at-home orders. Thousands lining the streets of Wisconsin.
We want to go back to work.
Rallying cries from Washington to Colorado to Maryland, where 31-year-old Amber Pinkham, who owns her own hair salon, says she's desperate for a lifeline.
Because I do not have employees on payroll, I do not qualify for it. Just because we work by ourselves doesn't make us any less of a business.
Today, Vice President Mike Pence is leading a call with governors to help them unlock more testing capacity within their own state labs. He insists there is enough capacity to help any state in America move into phase 1 of reopening if they see 14 days of downward trends. George?
Okay, Whit, thanks very much. Let's bring in Dr. Anthony Fauci now for more on this. Dr. Fauci, thank you for joining us again this morning. You just heard what Whit said about Vice President Pence, but we heard from governor after governor yesterday, including Larry Hogan of Maryland, your neighbor, saying that the governors just don't have what they need now to do the testing they need to do.
Yeah. Well, certainly I can empathize with the governor and believe them. What we need to do is make a better connectivity with the tests that are available, as well as the capacity that in some cases is not used through no fault of the governor or the local people, that there are now should be between 1.5 to 2+ million tests per week. There are people out there who say we need more. We need maybe 2 or 3 times that. We're striving for that goal, but in the meantime, with what we have, if it is used strategically, we feel we'd be able to have most people enter into phase 1 after they pass that 14-day gating period. We know it's a problem, and was just mentioned, there are things that are obstacles in the way that, George, we need a partnership between the federal government and the local people, including the governors, to help them get to things that they maybe not have any access to. So it really does need to be a partnership. Yeah.
So I was just saying, yeah, we know there are some supply chain issues, but you mentioned those experts who believe we need to be doing far more. There's a new study out from Harvard this morning that says we're going to need to be doing something like 5 million tests a day in early June to start opening, up to 20 million tests a day to fully reopen as soon as possible by the end of the summer. We're only doing about 150,000 tests a day right now.
Yeah. Yeah, we're doing about 1.5 to 2 million per week. We really need to get up to at least, maybe 2 times that, 3 times that. But we will, as we go into the coming weeks, looking forward as regions, states, cities start to go from the gate to the phase 1, and then ultimately, hopefully, to phase 2 and 3. So we're certainly going to need more. I think the issue, George, is that not saying that the people out there are not correct in what they feel they need, because they do need a baseline amount to do the kind of testing that would allow identification, isolation, and contact tracing. If you talk about tests for doing a lot of other things, which ultimately are important, but they're not absolutely critical to get to that situation where you can identify, isolate, and contact trace, there's got to be a meeting of the two. There's got to be more supply, greater access to untapped capacity, which there are. And, the governors do say appropriately, well, maybe there's untapped capacity, but how do we get to it? So we've really got to help them to get to it. And that's what's being done right now, to try to make the connectivity between what's unused capacity as well as tests within that capacity to help them. We've got to keep going, and it's got to be done together, really in a partnership.
Everyone is also wondering about antibody testing. We know that Governor Cuomo here in New York is expanding antibody testing. We've seen that overseas as well. But explain to everyone at home what those antibody tests can show and what they can't show.
Yeah, George, thank you for giving me the opportunity to address that, because there really is a lot of misunderstanding about antibody tests. An antibody test is not saying whether you have the virus now. It's saying whether you were exposed, infected, and likely recovered from the infection. What it is a measure of the proteins in the body that respond to the virus in question. The problem is that these are tests that need to be validated and calibrated. And many of the tests out there don't do that. So even though you hear about companies saying flooding the market with these antibody tests, a lot of them are not validated. Point number one. Point number two that's important is that we do not know exactly what an antibody titer means. I mean, there's an assumption, a reasonable assumption, that when you have an antibody that you are protected against reinfection. But that has not been proven for this particular virus. It's true for other viruses. I think it's a reasonable assumption, so you wouldn't say, you know, that's an absurd idea. It isn't. I mean, it happens with other viruses. But we don't know how long that protection, if it exists, lasts. Is it 1 month, 3 months, 6 months, a year? So the assumption that with the tests that are out there, if you have an antibody positivity, you're good to go, unless that test has been validated and you can show there's a correlation between the antibody and protection, it is an assumption to say that this is something that we can work with. We still have a way to go with them.
And finally, sir, we're seeing these protests crop up all across the country right now, including those protests in Texas and other places where they're saying fire Anthony Fauci. Fauci is wrong. They're resisting these stay-at-home orders from governors. What's your message back to those protesters?
Yeah. I mean, I think, you know, the message is that clearly this is something that is hurting from the standpoint of economics, from the standpoint of things that have nothing to do with the virus. But unless we get the virus under control, the real recovery economically is not going to happen. So what you do if you jump the gun and go into a situation where you have a big spike, you're going to set yourself back. So as painful as it is to go by the careful guidelines of gradually phasing into a reopening, it's going to backfire. That's the problem.
Dr. Fauci, thanks for your time again this morning.
Yeah, good to see you, George. Thank you.
And thank you, George. We're going to turn now to how the outbreak is taking a toll on nursing homes all across the country. The death toll climbing past 7,000 in the United States, making up nearly 25% of COVID-19 deaths in New York State. Now, families and officials are demanding answers. Stephanie Ramos has the latest.
The numbers are stunning. In nursing homes alone, 7,300 people have died from the coronavirus. The total believed to be much higher when the numbers from states that have not been keeping track are tallied.
Nursing homes are still our #1 concern. The nursing home is the optimum feeding ground for this virus.
In some facilities, dozens have died. 55 people at the Cobble Hill Health Center in Brooklyn, at least 45 at the Kings Harbor Multi-Care Center in the Bronx, and at New Jersey's Andover Subacute Nursing Home and Rehab Center, where an investigation is now underway. At least 68 people have died since January, dozens from the virus, including 2 nurses.
It's more than huge. It is the most awful thing. It's now hit a crescendo in nursing homes and our most vulnerable citizens in this country.
Families panicked. Berna Lee's mother is being treated at the Sapphire Center in Queens, where at least 26 have died of COVID-19.
Even when they told me she had pneumonia, I asked if she was going to be tested, and they said no. And the responses ranged from, we don't have enough tests, we're not testing anybody, to your mom doesn't have any of the symptoms, or she doesn't have enough symptoms.
Caregivers getting sick and staff at a breaking point.
No one could ever possibly be used to what we're going through now. There is no place that is safe from COVID at this point in time.
The Centers for Medicare and Medicaid Administrator just announced new transparency measures requiring nursing homes to tell their residents, their families, and the CDC if they have any positive cases of COVID-19 at their facilities. Amy.
Yeah, it's just such a heartbreaking situation. Stephanie, thank you. Well, turning now to the economic toll and how retailers taking a big hit from the pandemic. High-end department store chain Neiman Marcus may be just days away from filing for bankruptcy protection. ABC's Rebecca Jarvis joins us now with more on this. Good morning, Rebecca.
Good morning, Amy. That's right. ABC News has learned that Neiman Marcus could file for bankruptcy as early as this week. It is a private equity-owned retailer saddled with debt, and they are now behind on those debt payments. They have furloughed nearly 14,000 of their employees, shuttered 43 of their locations, all of them across the country. And like so much of retail, they are facing these unprecedented headwinds, not just through the coronavirus, but leading up to the coronavirus. Sales were truly struggling there, as well as at other retailers like Macy's and JCPenney. And Amy, we know at least 1 million retail workers filed for unemployment benefits just last week alone.
Wow, and those are some big names in retail business. But what about small businesses that are also struggling to survive right now?
Well, and we know that small businesses received $350 billion through that PPP program, but the money ran out, and now Congress and the White House are working together to appoint an additional $300 billion, which Secretary Mnuchin says could come as early as today. 1.7 million businesses have received those loans, and at least one, Shake Shack, says that they will return their $10 million in loans after a major outcry from people saying that this money should go to small businesses.
All right,
Amy?
all eyes on Washington today. Rebecca Jarvis, thank you. Michael?
All right, thank you, Amy. And now, an inspiring story to start your week. That incredible One World Together at Home concert raising a whopping $128 million for COVID-19 research, charity, and first responders, and doing it with some serious star power. Have a look.
Let this be our prayer. Let this be our prayer. Just like every child. Just like every child. Need to find a place.
Incredible performance there. And other incredible performances this weekend included Taylor Swift, the Rolling Stones, and a surprise appearance from Beyonce with a poignant message about how the virus is disproportionately affecting African Americans. We're going to have more about this incredible event in our next hour.
I had
But
chills
how
just
beautiful
listening
was
to that. So beautiful and moving.
And moving, and $128 million to help. We are following a lot of other headlines this morning, including Facebook announcing a new plan to use its immense reach to help track the virus. We have Georgia's exclusive interview with Mark Zuckerberg in just a moment.
And then our Last Dance exclusive, the Slam Dunk Chicago Bulls docu-series, trending big. We have a first look at a moment that hasn't aired yet. You'll have to wait for that. But first, let's go to Ginger, who's at home.
Amy, it was another busy Sunday. You had damaging winds in excess of 100 reports, 7 reported tornadoes. These videos out of Baxterville, Mississippi. And now I want to show you what's happening this morning. We've already seen tornado watches, severe thunderstorm watches as far south as Sarasota, Tampa included there. That's for that line. It'll move into the Northeast tomorrow. And here's what concerns us. First and foremost, the safety of everybody. But second, we saw in Harris County, that's Texas, Houston, they had those COVID-19 centers for testing close. So that might happen in the next couple days. Let's go ahead and get to the select cities now, brought to you by SoFi.
I came across SoFi and it was the best decision of my life.
I feel cared about as a member.
We're getting a super competitive interest rate on our money. We're able to invest through the same exact platform.
I really like that they didn't have any hidden or extra fees.
SoFi has brought me peace of mind. Truly, thank you for helping me prepare for whatever the future has in store.
Well, happy Monday. Have the indoor activities ready to go for the kids this week. You've got rain chances every day this week, except one that's going to be on Wednesday. So today we're starting out milder, temperatures in the lower to mid 50s across the area. We had a high temperature today, 62 degrees at 4 o'clock. Best rain chance now until noon, little late day sunshine. Rain, thunder tomorrow, especially between 2 and 4 p.m. And then Earth Day, the high 61 degrees, the one day this week that we are going to be dry.